Oh, there we go. Recording in progress. Okay, brilliant. So, on to why we're all here tonight. And if Chelsea, you're up for getting the slides up, that would be fantastic. Brilliant. So hopefully everyone can see the slides there. Okay, it's no secret or surprise to any of us on this call tonight that our NHS is in a deep, deep crisis, which has been years and years in the making. We had, next slide, please, Chelsea. Over a decade and a half of Conservative led austerity, underfunding, and fragmentation, which left our health service struggling to cope. Then, when Labour got elected last summer, I think many of us hoped that that would mark a real turning point for our NHS, and it should have marked a real turning point for our NHS. Yet sadly, aside from a few welcome changes in approach, this government has not delivered anything close to the transformative health policies that are needed to actually tackle the NHS crisis. And in fact, in certain areas, they've arguably taken an even worse approach than their predecessors. And the result, well, patients and health workers continue to suffer, whilst health profiteers are laughing all the way to the bank. Next slide, please, Chelsea. Yes, great. Yeah, 7.4 million. That's the latest figure for the NHS waiting list in England, and it had risen for 3 months in a row. I think it's just started to go down in the last figures, but it had been literally on the rise. In Wales, the waiting list is around 793,000. In Scotland, 639,000. In Northern Ireland, 358,000. In urgent care, the situation remains absolutely dire. 1 in 10 of those who attended A&E in 2024 to 2025 was forced to wait more than 12 hours for care. This summer, 1 in 5 A&E patients were looked after in a corridor. Throughout last year, ambulances spent more than 1.5 million hours, equivalent to 62,500 days, stuck outside A&Es waiting to offload patients. These dangerous delays are still leading to thousands of preventable deaths. And when it comes to staffing, there are more than 100,000 posts currently unfilled, including a staggering 9% vacancy rate in mental health. Surveys show that nearly a third of NHS staff often think about leaving the service, and 3 in 10 often feel burnt out by the conditions. So, lots of people are suffering, but not everyone is suffering as a result of this ongoing crisis. Some people, some companies are in fact doing extremely well out of it. Earlier this year, Labour announced a new deal, with the private sector, which will mean that its role in cutting NHS waiting lists will rise by 20%. This equates to £16 billion a year of taxpayer money being diverted from public NHS facilities to fuel corporate profits. Now, Labour is also considering a new iteration of private finance initiatives in the NHS, which lock NHS trusts into paying billions in debts and interest charges to companies who lend cash for capital projects. And we're going to hear more about this later from our friends at We Own It and Every Doctor. Then we have big pharma companies who have teamed up with Donald Trump to basically bully the UK government into accepting a 25% increase in the prices that the NHS pays for life-saving medicines, simply in order to boost their already huge profits. And of course, we can't forget big tech companies, notably the US spy tech company Palantir, who have been handed government contracts worth hundreds of millions of pounds to manage our precious health data. And it's likely that they'll be lined up for the next big contract or for the single patient record as well. So the truth is that in our political system, as it currently operates, money can get you pretty far. And politicians regularly accept donations from companies that are profiting from this crisis or attend secret lobbying meetings that the public don't have access to, which again, we'll hear more about later from Julia, Every Doctor. So, in summary, what we are seeing is a health system where millions of patients are not getting access to the care they need when they need it, and where health workers do not have the resources and support they need to do their jobs safely. And meanwhile, private profit making companies are gaining increasing power and influence, and they're raking in billions of taxpayers' money in the process. We think this system is rigged and needs to be challenged, and that's exactly why we're holding this webinar tonight. So we're absolutely thrilled to be joined by an excellent lineup of speakers, of NHS patients, health workers, and experts to dig into all of this further. And at the end of the call, as always, we will be sharing a number of actions you can take right away to help fight for change. So, first up, I'm very, very honoured to be passing over to two of our amazing Just Treatment patient leaders, Matthew and Raj, to share how the ongoing crisis in the NHS has impacted them and their loved ones, and why they have joined the fight for a better future for our health service. So I'm going to go over to Matthew first, who is amazingly joining whilst at work. So if he has to be called off, we'll know why that's happening. But yeah, over to you, Matthew. The floor is yours.
Thanks very much, Hope, and it's great to be with you, everyone. And not only am I at work, but as you may be able to tell, I've got a cold as well, so I'm on the Lemsip. So I'm fighting through to be with you tonight. So I'm Matthew. I'm from Hinckley and Bosworth in Leicestershire. And I'm passionate about campaigning for a properly funded and a properly public NHS for a very personal reason. So on the 10th of July 2022, my dear mum Jackie fell at home. She'd fallen before, so she had one of these council things that she could press that would alert the council to the fact that she was having difficulty. I was then alerted in my flat in the next town. Myself and a friend got to mum. She said she'd hurt her ribs, so the advice was when we called for an ambulance not to move her, so we didn't. We called for an ambulance at 5:01 a.m. and 11 hours later at 4 p.m. a paramedic, first of all in a car, arrived, further called for an ambulance which arrived shortly after that. Mum was taken to hospital where she died 2 days later after an infection turned to sepsis. And of course, what I'll never know is how much the 11-hour wait contributed to her death. I subsequently, I should just say that, I'll never forget those 11 hours. They're stuck indelibly in my mind to see the person that you love most in the world in pain, in distress, begging me when is help going to come, and not being able to answer that was horrific beyond words. I called 999 every few hours. I know perhaps you're not meant to, but it was the only thing I had the power to do. And I kept being told that, we'll get to you as soon as we can. And of course, I appreciate that mum was breathing, so she wasn't the most urgent person. But I don't think that a 78-year-old in pain, scared and frail, should be left waiting for 11 hours. And I'll never know how much that contributed to her death. I later found out from the local ambulance trust a bit more about what was going on that day, and what I was told didn't surprise me at all. So basically what was happening was that ambulances were stuck outside the local hospital, unable to offload patients into the hospital, and the reason for that was because there were patients in hospital well enough to go home, but without a proper care package in the community or in society for them to be able to leave the hospital. So it was a whole system failure that led to my mum waiting those 11 hours, and potentially that led to her death. So my mum's story highlights just how interconnected the NHS crisis is, and how one failure leads to another, and leads to patients suffering. The reality is, with our national health service, is that it's been chronically underfunded for years. We know that we're below the European average for health services, and we know that we can get to that European average. It did happen before under the previous Labour government, to be fair to them, and we think that it can happen again if government has the will. But at the moment, and successive governments, it hasn't had the will to do that. And we're also seeing increasing part privatisation of our NHS. And, I think it's very telling that when he was the Shadow Health Secretary, Wes Streeting met with me to find out about what had happened to my mum and to give me all sorts of reassurances. Has he wanted to meet with me again since he's become Health Secretary? No, he hasn't. Has he wanted to meet with patients from Just Treatment since becoming Health Secretary? No, he hasn't. And I think that's very telling. Who is he meeting with? Well, from all that we can gather, he is very keen on private healthcare providers. He's very keen on the likes of Alan Milburn and others. But does he want to meet patients who have suffered as a result of a lack of NHS care. And from all that I've just talked about, no, he doesn't seem to want to do that. And I think that's very telling. So I joined with Just Treatment as a result of what happened to my mum. And since then, I've spoken on the national media dozens of times about what happened. It's never easy to do it. It's not easy here today to talk about what happened to my mum, but I'm prepared to do it in her memory. I've been to Downing Street twice with petitions. I've taken part in campaigns that have been given national media coverage, and I've done all sorts of other things as well. And it's because I don't want another family to suffer like mine has. But sadly, families are suffering that way every day. And that's why we need a change in the NHS, and we need it today. Thanks.
Thank you so much, Matthew. Yeah, it's just such a privilege and an honor to have been able to campaign with you for I think 3 years now, and I've heard you share that story loads of times, and it's still just as powerful every single time. And I also know that it's very difficult for you every single time to share it. And it's just so brilliant that we have the leadership of people like you who are willing to put those stories out there for the sake of the greater good and for the sake of collective health. And you can see all of the emoji reactions. I hope you can see them on your phone, Matthew. There's lots of emoji reactions coming through and nice words in the chat. So thank you so, so much for joining us. And I'm very excited to now call up another of our fantastic patient leaders, Raj, over to you to share your experiences as well.
Hi, yeah, I'm Raj. I'm one of the Just Treatment patient leaders. Just Treatment is very much patient-centered and patient-focused. And I come from what I call an NHS family. My mother and father both spent their entire careers as clinical workers in primary care on the NHS. I developed a rare disease in childhood, which has meant that I've been necessarily being seen by the NHS in the NHS my whole life, and additional problems and complications over the years added to the problems. I've spent time in inpatient care. I had a lot of outpatient care as well, and I also I became a pharmacist. So I was seeing the NHS both from inside and from outside, and from the context of being part of an NHS family where everyone was involved, working for the NHS. And I've seen the NHS over all those years, and I honestly feel at the moment that it's all the worst, in one of the worst conditions I've ever seen. Service availability, service provision, and importantly, staff morale are all very bad and not good. And the inflection point for me, from my point of view, was 2010, which is when we had a change of government. And from that point on, things have just been going downhill. And there was a hope that the recent change of government would make a major difference, and it does not seem to have done that. It's fine. The government sending out recently, they sent a social media message out saying that ambulance waiting times have fallen by 10 minutes. This is great, but when ambulance waiting times are sometimes measured in 10, 12 hours, as with Matthew's mum, the 10 minutes is unfortunately not going to make that much of a difference, especially when we consider the what's called the golden hour, the first hour during which, after a patient is injured or has some type of medical episode, where that hour is so precious. Further you get from that time, the worse the outcome tends to be. Intervening in time, and this is for injuries and things like heart attacks, strokes, but also preventative care, checking a patient's blood tests, doing scans as necessary. That saves a huge amount of money, not even considering the fact that it saves a huge amount of psychological, physical, and pain for the patient and for their families and their loved ones. And that has especially been badly affected and continues to be badly affected. This is what I notice. One of the major problems for me is that regular surveillance, regular monitoring is very difficult to do because the staff are so overloaded, under-resourced. and the ironic thing is, in the long term, that's going to end up costing money. And like I said, not even considering the emotional and physical costs. Moving on, there's many different things happening at once. Drug pricing and the recent policy of the current American government, they are trying to influence drug prices. They're trying to push drug prices up in other countries. Now, drug prices in the US are an internal matter of the US. The US has deals, or maybe it doesn't, but the United States obtains medicines, and the governments of other countries around the world have done deals with drug companies, to whether that's seen as good or bad, but to bring down the costs of medication. What the current US administration is saying is, no, those deals are just meaningless. They're torn up, and we will decide how much you in the UK, France, Germany, Italy, wherever, pay for your medications. And of course, they're not going to ask for the price to be less, but rather more. Now, this means that medicine supply, in my opinion, as a former pharmacist, and having observed how this sort of thing works, it's not a direct relationship, but the higher the prices of the drugs, unfortunately, the more supply issues and shortages you're going to see, because it simply makes obtaining the drug, a particular medicine, at a reasonable price, which pharmacists have to do, more difficult. Because if the price is higher, they're going to struggle to find the product needed available at the price they require. And so the USA's demands at the moment is going to inflame the problems we have already. And finally, I got involved with Just Treatment to try and make a difference. I've been following emails, but I hadn't been involved in real life personally. And recently got involved. I helped hand in a petition at the Department of Health. And that was the start of my deeper involvement. And you're not meant to smile in petition photos, but I couldn't help myself, because I was having it was just such a wonderful occasion. I felt it was just great. So everyone else was not smiling, I was. Just Treatment have various campaigns going on. We had the petition hand in about drug pricing. There's currently a campaign to try and get West Streeting to speak to a group of patients and patients' representatives, patients' families. And there are others. So I would suggest to everyone, please go look at the website and have a look at the campaigns that are being run, because there'll be other campaigns in the future. And I just want to finish by saying that Just Treatment, as well as other organizations, advocate for patients and staff. And that's so important, because staff are as much part of the structure of the NHS as any number of buildings or CT scanners. Without the staff, you don't have a health service. And so solidarity between patients and staff, I would say, is very, very important. And can I hand back to Hope?
Wonderful. One excellent point to finish on, Raj. Patient staff solidarity. We love to hear it. And yeah, thank you also for joining and for sharing your story and for sharing with everyone about the issue of drug pricing. Is so critical, really well explained. And yeah, it's been an absolute pleasure to get to know you in like recent months, and I'm very excited about you and many other fantastic patients being at the forefront of our campaigns going forward. So thank you so, so much. And I should also say, I know there's lots of chatter in the chat, which is great. We are going to have a Q&A section towards the end of the call. So if there's any thoughts or questions that come up throughout the call, please post them in the chat. And Diarmuid is going to be kind of compiling them, and then we'll kind of come to answering them towards the end. So yeah, please do make use of that. Cool. So we've heard from some very powerful patient voices about how the NHS crisis is decimating our quality of care. But what about the people that are expected to deliver that care in increasingly difficult conditions? As I'm sure everyone here is aware, resident doctors have just finished 5 days of strike action over pay erosion and the crisis of available places for specialist roles, after the government failed to offer solutions which would be sufficient to meaningfully tackle the workforce crisis. So next up, I'm delighted to introduce A&E Dr. Andrew Mayerson, who has joined us this evening to talk about how the crisis is being felt by NHS staff on the front lines and why strike action is happening and why it's so important that patients and health workers campaign together. So over to you, Andrew.
Everybody, thank you so much. Raj, Matthew, and everybody on the call, thank you so much for joining us. It has been an exhausting week, but an important one. And I have been in love with Just Treatment with you guys for a very long time. It is so important that NHS staff and patients are united because we are all fighting for the same thing, which is an improved NHS. And I think that a national project to restore the ranking of the NHS back to its #1 spot in the world, I think is a goal that we all desperately need and we all share. And so just a bit about the what it's like in hospital at the moment. And all I can say is body cameras, body cameras, body cameras. Because it seems that in a lot of A&Es and a lot of NHS institutions, that is what a lot of places are turning to in order to give a semblance of protection to staff, so that patients who are rightly furious with their care at the moment are somewhat more reluctant to start a fight with us. I've been punched in the chest, in the neck. I've had somebody spit directly in my face, and been told to go back to my country. And I am a 6'3", 120 kilo American doctor, and so imagine what somebody who doesn't have who is a person of color, who's not from the States, who is a migrant worker. Imagine how they get treated. It's awful. And at a previous hospital where I was, in the staff room, there was a big plastic jar that had red, yellow, and green little plastic tabs that you can put in the box. And that is for the management to understand how many incidents of verbal abuse, of racist abuse, of physical violence that we've seen on a daily basis. And the numbers of tokens that get inputted into that jar just grow and grow. And it's awful to see that, and it creates, because patients are forced to wait for record times in A&E at the moment, on the worst day of their lives, in pain. And I've seen some awful waiting rooms in a couple of hospitals around London, and I know this exists around the country as well, where patients are suffering. They are miserable. They are hurt, and they just desperately want care, and they deserve care, but we don't have enough staff to be able to deliver it. And so you see increasing stress in our work environment. I'm aware of. I'll move on to quickly about why we took strike action before I run out of time. Look, this has been a fight for pay restoration, to make sure that that resident doctors who are doing life-saving work are paid more than £14 an hour for their labor, which is not unreasonable. And we went from £14 an hour to £18 an hour, but we are still 20% down from what we were earning back in 2008. And that needs to be restored, because we are seeing a hemorrhage of doctors, 20,000 every year. We're seeing 40,000 nurses leave every year. And these are senior level people who are going abroad or going to the private sector, where they can earn more money, they can have a better quality of life, and they're being forced out of the system. And when those people are being forced out of the system, it means that patients don't have access to care. And that is something that absolutely needs to change. And the new issue on top of the pay restoration issue, which is ongoing, is that 20,000 doctors were left without a job this year, And in a situation where you have the worst waiting lists in NHS history that have barely come down after a year and a half of this Labour government in power, to have doctor unemployment is ridiculous. It is a failure of government, and it denies the hopes and dreams of so many of us. I have colleagues that grew up wanting to become a cardiologist, wanting to work in emergency medicine, who will no longer be able to live that dream in this country because of the policies of this government, because they are continuing the policies of the previous government, which is to underfund the system, undermine it, to push more of the population into private healthcare, and also to push a lot of us into private healthcare as well. And so they are denying patients doctors, they are denying patients nurses and other allied health professional staff, and they are denying their right to care, and also denying us our dreams. And if you are a resident doctor who had a dream of becoming a neurologist or a cardiologist, and you can no longer live that dream in this country, what do you think that person's going to do? They are going to leave the country. They're going to go elsewhere where they can chase their dream, because that's important to them. And I don't blame any of my colleagues who make that decision, who do that. So look, this is I will tell you this up. Thank you for joining us tonight. This fight, our fight, is your fight, is all of our fight, because this is about restoring the doctor-patient relationship. This is about restoring everyone's right to healthcare. Whether you are poor, whether you are rich, you deserve to have an ambulance, immediately when you need one. And that is what this fight is about, because otherwise they are going to quickly turn this into an American-style system. And we know who is knocking on the door of government right now, and we know what their policies are going to be when it comes to the NHS. And so that is why, we've been saying for years, save our NHS. We need to protect the NHS. They're harming the NHS. The NHS is about to be privatized. We have never been in a more dire situation than we are right now. And that is why the fight over the next couple of years, and we need to treat patients and reform voters with love and respect, and we need to educate them, but then we need to go after the leaders who are taking advantage of their platforms, and taking advantage of people who are hurting right now. But we have to continue fighting for each other and for our patients, or for the NHS, because if we don't, then it will all be gone. Love you guys. Thanks for being here.
Thank you so much, Andrew. We love you too. There's lots of love in the chat and solidarity for you and your colleagues taking this action. And I'm sure there is a lot. I certainly feel absolutely disgusted about the way that health workers are being treated, and the way that Wes Streeting is taking to the media to demonize you all. A man who, frankly, wouldn't last 5 minutes in one of your hospital wards, Andrew. It's absolutely, it's just like a complete insult. And, as you've also alluded to, it's certainly not just doctors who are battling unfair paying conditions. We heard, just recently, consultants are considering joining the strike action over pay erosion. We also know that nurses overwhelmingly rejected a pay offer by the government and could still decide to take further industrial action. Over the last few years, we've seen unprecedented action from health workers across the service, which just highlights how unprecedented this crisis is. You guys don't take this action lightly, sorry. You want to be providing that care for patients. So, we've got to stick together in this fight. We absolutely have. And, if they succeed in dividing us, then we will fail. So we can't let them win, and we're not going to let them win. And yeah, as we said, patients and health workers, clearly from the testimony you've heard tonight, are really suffering as a result of this crisis. But whilst patients and health workers suffer, there are some who are making a killing out of it. So in this next section of the call, we are going to delve a bit more into the corporate actors that are gaining money and influence whilst our NHS crumbles. So first up, I'm very delighted to hand over to Julia from Every Doctor, who is going to speak to us a little bit about PFI, but mainly about donations to MPs. And so, yes, very excited to hear from you, Julia. Go for it.
Hi, everybody. Lovely to see you this evening. And I just wanted to echo what Hope was saying. I've really enjoyed listening to the speakers. It's really fantastic, actually, to draw all the elements of this crisis together. It's so necessary, because I think sometimes we can get locked in the silo of sort of our own understanding, and hearing from patients and staff and campaigners kind of ties it all together and reminds everybody, I suppose, how important it is that we stay connected with one another. So thank you so much, Just Treatment, for running this session. I run an organisation called Every Doctor. I'll just explain very briefly what it is that we do. And we've been doing some research recently into various aspects of privatisation, but there was some things I wanted to draw your attention to this evening. We're an organisation that started off as a big group of doctors, and we now have lots of other people involved who aren't doctors. And we believe, just as the other organisations and individuals this evening have said already, that we think it's really important that patients and staff come together to speak up about what's going on. When we were just doctors speaking up, put frankly, there just weren't enough of us. There's obviously a much wider group of people out there who care about the NHS, have a stake in it, just like the doctors do. And we also think it's really important to break down the barriers which are created by unhelpful media outlets who pit the staff and the patients against one another in active ways. We're all on the same team ultimately, so we need to push back together, as other people have said. We do a range of different things. We try to influence political policy where we can, when that seems like a good idea. So we sometimes run MP parliamentary briefings. We've done over 30 of those since 2020. We run research into privatisation and other things. We have an investigative journalist on our team who does quite a lot of that work. We also run campaigns on other things when particular issues or crises crop up. But I wanted to talk specifically this evening about recent research that we've been doing into privatisation related issues. Now, I'm going to caveat what I'm about to tell you by saying that it's very difficult to understand in Westminster how influence is bought or built. But what I will say is that we're certainly very concerned about the movement of money through Westminster, have been for several years now. And I think a lot of us would have hoped it would improve when Labour came to power, but unfortunately, I don't feel that that's the case. We've done a project looking at the people and companies linked to the private sector who have been donating to MPs, and we've been trying to draw together some patterns to try and make sense of what's going on. Now, some of this research is ongoing. We're actually about to publish some new figures, but the information I'm going to be telling you about this evening is from research that we did between January 2023 and March 2025. I wanted to explain the extent of what's happening. So between January 2023 and March 2025, we have found that MPs received more than £2.7 million in donations from people and companies linked to the private healthcare sector. To put that into perspective, that's enough money to pay for about 90 NHS nurses for a whole year. And unfortunately, the MP who has received the highest total donation amount from people and companies linked to the private healthcare sector is none other than our Health Secretary, Wes Streeting, who accepted £224,575 during that period from people and companies linked to the private healthcare sector. It's quite a staggering amount of money. A number of other ministers have also received donations of that type. Someone from my team called Florence is here this evening. Florence, would you mind popping the link in the chat to our privatisation research in case anyone wants to go and have a look? Because basically, guys, you can look up if your MP is on our list and find out where they've been receiving donations from. It might be interesting to you. Something that I don't know if it's surprising or not, it was certainly depressing, is that we did a comparison between the different political parties to work out which of the parties had MPs receiving the highest total amount of donations. And during that time period, Labour MPs received 4 times the total. So the donations that in total were accepted by Labour MPs from people and companies linked to the private healthcare sector were 4 times higher than all of the other political parties combined during that period. And I suppose the reason that concerns us is that it seems like this money is following power. And that would concern any of us, I think, thinking about the decisions that politicians are making and who's influencing those decisions. And it does really feel to campaigners like it's an uphill battle at the moment, because the money does seem to be following whoever is in government. It was, we had enormous concerns about the Tories. Now Labour has come to power. We would have hoped, I suppose, that those donations wouldn't continue, but there's a lot going on. I wanted to highlight a few things about the donations that we've found. So Labour Together is an organisation that was previously run by Keir Starmer's Chief of Staff, Morgan McSweeney. And Labour Together, as an organisation, donated more than £1.4 million worth of those donations to Labour candidates ahead of the election. And the reason we find this situation concerning, and honestly, I think it needs more attention, is that Labour Together receives the donations and then Labour Together then allocates the money to MPs. And so we had people, when we published our research, suggesting that our research didn't hold much water because some of the money wasn't coming directly from individuals or companies. It was going through Labour Together and then being given to MPs. And my feeling about it is that it creates a sort of buffer, or a sort of, it kind of washes the money so that it looks like the money isn't directly coming from one person or a company. Do you know what I mean? Like that concerns me. Labour Together has two really big funders. One of them is called Martin Taylor, and he has a hedge fund which is called Craig Asset Management, which holds over $20 million in shares in United Health, which is a really massive private healthcare company in the States. And another big funder include a businessman who's called Trevor Chin, and he's a senior advisor to a private equity firm called CVC Capital Partners, and that organisation owns stakes in dozens of private healthcare companies across the UK, Europe, and Asia. And so some people would argue that it's not money that's directly coming from a private healthcare company, but we have concerns about any person really who has a clear link to private healthcare themselves then deciding to donate to a politician. We don't think it should go on. I just wanted to highlight two more situations, and then I'm going to hand over, Hope, if that's okay. So more than £300,000 worth of the donations that went to MPs came from companies that were already making money providing services to the NHS, which to me feels very wrong. And also MPs received almost £100,000 from lobbyists whose clients have included private healthcare companies. And among them is the Chancellor Rachel Reeves, who accepted a free campaign advisor from a political lobbying firm called FGS Global, which is a donation in kind worth more than £17,000. The firm also funded a further £12,929 of logistical costs for Reeves at the Labour Party conference last year. There's a lot more information in a report that we've written that I think you can have a look at if you click through the link Florence has shared. But I don't want to take up too much time. I'm just going to mention one last thing before I hand over to John Bosco from We Own It. We've just been doing some new research into PFI, which is the Private Finance Initiative projects that happened a long time ago. I'm just going to explain briefly what they are and what we have discovered, but I'm going to let John Bosco explain more because they've also been doing some really fantastic work on this, and I don't want to hog the microphone for too long. For anyone who doesn't know, PFI deals were private finance initiative deals that were done by politicians several decades ago. Essentially, we needed lots of public infrastructure like hospitals, and they didn't want to put the upfront investment in place, and so they partnered with private companies to do that. And it was sold to the public as a great scheme and that we'd pay these private companies back over a very long period of time. It's actually been a total disaster for public finances, and certainly with the NHS hospitals built in England, the initial investment into those hospitals, I think, was £12.8 billion, something around there anyway. By the time we have paid all of those private companies off, by 2050, we will have paid back something in the region of £80 billion. And so that's a big difference. We're still in enormous debt because of this situation. It looks like Keir Starmer and Wes Streeting are going to be announcing some new PFI deals or something very similar for the NHS. And the reason we all think that, I think there's a lot of knowledge in this room probably about this, is because the NHS 10-year plan that came out in July spoke about 200 neighbourhood health centres, which are central to the plan, and yet it wasn't specific about where the funding was coming from. And so lots of people have found out all the information they can, and it now looks like the government is consulting about introducing private partnerships of that type. We've been doing some research into it. I'll just tell you one fact and then I'm going to hand over to John Bosco. So We've been looking into the debt that's currently held by NHS trusts for the old PFI schemes that were set up several decades ago, and we've discovered that 69 NHS trusts in England they're locked into paying over £21 billion over the next 2 decades to the private companies because of the PFI deals. It's a huge amount of money, it's a staggering amount of money, and we shouldn't enter into any more of these deals. It's a really bad idea for the NHS, and it's also a bad idea for the taxpayer. And now I shall hand over to John Bosco, because I think he has some really excellent campaigning work to update you guys about.
Thank you so much, Julia. Over to you, John Bosco. I won't waste any time.
Yes, thank you so much. Thank you, Hope, and thank you, Julia. It's been really, really incredible for me just sitting here and absorbing all of the remarks from Raj and Matthew and Andrew and of course Julia. I wanted to start by saying a little bit about We Own It. We Own It is a campaigning organization that is a voice for public service users. So we don't just work on the NHS, we campaign across the range of public services from rail to water. We've been campaigning recently about the disaster that is called Thames Water. And yes, so we believe we use these services, we rely on them for pretty much a civilized life. We should own them. They should not be at the whim of the market. Private shareholders from across the world should not use our public services as their, I wanted to say little piggy bank, but it's a pretty big piggy bank. And they've made billions of pounds from taking advantage of our public services, and we think that that should stop. And obviously, over the last few years, we've won some victories, including stopping the planned privatization of Channel 4. By the last Conservative government, we stopped the privatization of NHS Professionals, which is a portal that the NHS uses to hire staff. We managed to get 11 regional NHS bodies called Integrated Care Boards to pledge to ban people who own or have shares or interest in private healthcare sitting on their boards. I wanted to speak to you this evening specifically about the work that we're doing on private finance. Julia has already done, I thought, a really, really good job of introducing you to, I imagine a lot of you already know about PFIs, but it's often talked about as though it's a thing that happened in history. NHS trusts still owe huge amounts of money to those PFI deals that were signed even as far back as John Major, but at the very least since Tony Blair. Our analysis suggests that the figure could be as much as £40 billion, but analysis from every doctor suggests it's closer to the region of 25 to 30 billion pounds. Now, as Julia indicated, the government is proposing to bring back private finance for building neighborhood health centers. And they do indeed say in their 10-year plan that if they can find private finance, that they would use private finance to build the second tranche of those neighborhood health centers. We also were able to reveal through FOI requests that they had contracted with Deloitte, the consultancy firm, and paid them £3 million to advise them on bringing back private finance to the NHS. So we know that this is something that they're looking at. It's not an exploration at all. From our point of view, we know that they're thinking about doing it. So I wanted to say a little bit about the range of things that West Tweeting is looking at the moment. Obviously, what he has said to us from our engagement with the Department for Health is that they're looking at all the options on the table. And of course, that means PF2, which was the Conservatives, you might remember, banned PFI in 2018, but they then introduced something called PF2. And subsequently, we had something called LIFT. Then there is something in Wales that they call the mutual investment model. There's something in Scotland that they call the non-profit distributing model, all of which are versions of private companies borrowing privately to build facilities, which the NHS uses and then pays them extortionate, basically rents over 25 and 30 years, which results in paying 5, 10, sometimes as much as 27 times what the initial capital investment was. And if somebody asked you what is it that's wrong with PFI, right? Because they often try and present it in what can look to you like a rational way. What's wrong with PFI? We don't have the money. We are going to get them to pay for it, and we could pay gradually over the next few years. Now, think about it this way. If an NHS trust has a budget of £10 in 2025, and in 2026, that budget has, let's say, lost £1 as a result of inflation. It's lost a further £1 as a result of growing need because we have an aging population. And then you've added debt to its books. So let's say it's lost a further £1 because of the new debt that you've put into its books, but you have not increased their budgets. As we know, the government is not increasing NHS budgets to keep pace with inflation. You have not increased their budgets to keep pace with inflation and any of these other increased expenditures. What do you think is going to happen? What is going to happen is NHS trusts are going to have less and less money to treat patients. The New Statesman has found, for example, that a good number of NHS trusts are spending about 15% of their budgets on PFI repayments. That is before they have this new debt, right? And that in a lot of those cases, they're spending more on PFI repayments than they are spending on medicines for their patients. So if you're on an NHS waiting list, or if you're unable to get an ambulance, or if you or any manner of thing that could happen to you in the NHS is probably linked in some way to the fact that that local NHS body does not have enough money to treat you properly. And of course, it's linked to the fact that the NHS may be having to pay some more money now for medicines. So this is an absolutely horrific idea that we absolutely have to fight and stop from happening. So over the last few weeks, we've run a number of campaigns or a number of actions that we have been hopefully using to put pressure on the government. We worked with MP Dr. Simon Offer, who's a GP, but also an MP, to send a private letter to Rachel Reeves' office. It was signed by almost 40 Labour MPs. That letter was passed on to the Department for Health, and since that letter was sent, there's been a bit of a storm behind the scenes of the Department for Health calling MPs into meetings and sending them letters and all sorts of things. So it's clearly having an impact. And beyond that, of course, we've worked with 53 academics to put out an open letter to Rachel Reeves recently. We targeted specifically academics who work in accounting and finance because they're the ones who are going to tell us whether this accounting trick makes sense, and obviously it doesn't. They tell us that it doesn't. So it was really powerful to hear from them. And finally, yesterday, we had a protest, of course, in front of the Department for Health, where a number of MPs and patients and campaigners spoke out, demanding that the department drop these plans. This last night, actually, I think it happened at about 11 p.m. An early day motion that we've been working with MP Kat Eccles on came out, and it now has, I think, 34 or 35 MPs already signed up over the last less than 24 hours. And tomorrow we hope to get that message to more MPs and get them signed up. And we hope that puts more pressure on the government. What is really, really important, and I think a lot of MPs don't know what's happening here, is that the government is doing a propaganda effort, right? They want to do PFI in every way except the name. They want to do PFI, but they don't want to be seen to be doing PFI. So they're convincing MPs, we're not doing PFI, we're doing something else. And what we've produced is a briefing describing and explaining all these other models of private finance that the government is looking at, and explaining how all of them are essentially PFI. So if Hope could share in the chat a link to our recent action inviting people to write to their MPs and sharing this briefing with them. Almost 5,000 people have already done so. Please do write to your MP or send our email to your MP sharing the briefing with them. And also, of course, you can share the early day motion with your MP inviting them to sign on to it. Tomorrow, we will be sending out an email to our email list, inviting them to ask their MPs to sign it. And please do be the trailblazers on that and email your MP and get them to take action. This is really, really important. And I have a really strong feeling that we could win this. We could stop this happening. We will know at the autumn budget, but we will not rest until Rachel Reeves rises to make her speech. Thank you so much, everyone, for being here, and Hope for inviting us.
Amazing. Thank you, John Bosco. So wonderful to have both you and Julia here, and just, yeah, really great to be able to kind of collaborate across our like very aligned organizations. We love working with you guys and look forward to continuing to do so in the future. So yeah, thank you so much. I have done a terrible job of timekeeping in this meeting, so we are running a bit behind, but I want to make sure that we do have a bit of time at least for Q&A, and then obviously the actions at the end. So it might be that we end the call about 5 minutes late. I understand if some people need to hop off, and I know some of our speakers do too. So before we lose a couple of our speakers, I'm going to fire a few questions at specific people. So Julia, I know that there's been a couple of questions about taking money off companies and individuals. Isn't that a conflict of interest? And also a question about where the donated money goes. Do you want to just speak to those 2 points briefly?
Yeah, so I personally would consider this a conflict of interest. I mean, I think it's wrong that MPs would take donations of this type, and not all MPs do it. It's important to say. Lots of MPs don't do it. Now, what's difficult for us to understand is, are they not doing it because no one's offered them any? Or are they not doing it because they've taken a moral stance on it? I don't know the answer to that question. I actually think it would be quite an interesting project to do in sort of contacting the MPs and find out from the ones who don't take money, why not, what's going on here. So that's the first point, but it is allowed. So these donations that we have looked into, they are published. They're published in something called a register of interests. And then our investigative journalist has been going into them and kind of finding out more detail, because the register of interests is quite difficult to read and often would have to look into more detail and stuff. But they are published and they're allowed. I think it's deeply wrong, but they are allowed. So that's the first thing. The thing on where does the money go? I get asked about this a lot. We actually don't know, to be perfectly honest with you. I think probably the money goes to the MP to be used within their constituency to run their office. That is what I think happens. I don't know that with absolute clarity. Even if that's the case, though, and they are literally just hiring staff with that money and keeping the lights on or whatever it is they need to do in their offices, we've looked into the amount of money they are given to run their offices, which seems quite adequate to me. So each MP receives about £250,000 as a base level to run their office and hire people and all the rest of it. And then there are sort of there are variations on that, but they all have enough money to be running an office. And so my view on it is that even if all they are doing is hiring extra staff to make the running of their local constituency office better, I see that as benefiting a politician's career, because my experience of working with MPs is that the ones who have larger teams have more time to do research and better support for people and all the rest of it, which makes them look better, which is making them more likely to get elected, or giving them research so that they can stand up in the House of Commons to do something that's a personal interest of theirs, etc., etc. So sorry, that's a very long-winded way of saying I'm not quite sure. It doesn't get put in their personal bank account, I don't think, but I still think it's deeply concerning.
Brilliant. Thanks, Julia. Well, not brilliant. It's not brilliant, but brilliant to have you here to answer that question. And I know that you might have to hop off, so thank you so much for that. And I do want to come to Matthew, because I know you're at work, and so you might also need to hop off in a minute or two. There was a comment about, well, firstly, thanking you for sharing your story and saying, sadly, Wes seems to only want to meet with the Patients Association. I know he takes them very seriously, and yet they have a raft of interesting sponsors. And Diarmuid did a quick bit of research and sent me a graphic showing all of their sponsors, including AstraZeneca, Palantir, Eli Lilly, GSK, Novartis. So lots of corporate influence. I wonder if, Matthew, if you have anything you want to share before you have to hop off back to work about, I suppose, which patient voices are seen as valid and which are not, we would love to hear from you.
Yeah, thanks very much. And this has been a wonderful meeting, and solidarity with everyone. Yeah, I mean, it just doesn't surprise me at all that Wes Streeting is likely to be meeting with that sort of people. And just going back to Judy's answer just then, I mean, even if these kind of private health providers that are funding the likes of his office say, well, we ask nothing of West Streeting. Yeah, that may be true, but just the fact that they heavily donate to him, I would argue, I'm sure he'd deny it, but I would argue in of itself, you know, whether subconsciously or consciously, has an impact on his decision making. And so they don't need to actually ask for anything, and it's probably better in a sense if they don't, because then there's no paper trail. But just the fact that they're donating so heavily to his office, I would argue, must have an impact on his decision making as the health secretary, and I think that's very worrying. And I'll just leave you with this: that I know that at this moment there'll be people up and down this country who are stuck on their bedroom floor or wherever, waiting for an ambulance to come, in pain, in distress, and wondering what is happening to our health service. And that is why this campaign is so important.
Yes, Matthew. I think that's what we call a mic drop moment. Thank you so much for that, and thank you for joining us at work. You're awesome. And yes, I long for the day that we get you in front of West Streeting to make these points to his face. It will happen. We will make it happen. Andrew, I might pick on you next because there's been a lot of questions and a lot of chat in the chat about physician associates and the role that they are playing, a lot of concerns around that, how it relates to potential sort of like strategies to maybe kind of like replace trained doctors slash like displace trained doctors. There's a lot there to unpack, I'm sure, but any kind of thoughts and reflections you have on all of that stuff would be great to hear.
Absolutely, and thank you again for everybody's contribution. It was so wonderful to listen to John Bosco and Julia. Thank you for your amazing contributions. I learned so much myself when I'm on these calls also with you guys. About physician associates, I work with a number of PAs, and I just want to say that I work with a number of good ones. These are people who have not done a medical degree, who have, I think, any general degree, maybe science related, and then a two-year job to be able to become a physician associate. It does very much feel like the government is employing as many of those as possible, and there was a specific fund in our GP surgeries over the last couple of years to increase the number of PAs that a practice can employ. That same pool of money, they were not able to hire extra GPs from that. It was only PAs. And look, they are, they're good people, and I work with I've worked with a number of them, but they are not doctors, and it is a cheapening of the expertise in the system. When you have senior level nurses and you have senior level doctors that are leaving the NHS in record numbers, and you deny training opportunities to doctors, and then you put a hell of a lot of money into training training physician associates who are locked. Also, they're locked into working here. They can't. It's not a transferable degree to another country, and so the government has them hostage. And I feel like and a lot of patients feel like that their care is certainly not as the quality of care that they receive is not nearly as good as with a well-trained or certainly a senior doctor, and certainly with a GP. I just have to say that about there's one job in the NHS that I could not do, and that is the role of a GP, because you have to be really intelligent, you have to be quick, you have to be kind, you have to do all of that work really quickly. Also, you have to do it independently, without a team behind you, without all of the tests that we can easily run in A&E. And so I have enormous respect for GPs, and the core of that relationship is being destroyed. We know that patients are safer when they have a GP that they see all the time, that knows them, knows their family. The outcomes are so much better, and it is yet another tragedy of short-termism in politics, of a government that wants to destroy that relationship. And so solidarity to all the GPs out there, and solidarity to all the patients who can't get a GP appointment. And if you can't get a GP appointment and you need to come see us in A&E, please do. If you can come in on a Thursday morning at 6:30 in the morning, that's probably the best time to come in. Don't come in on a Monday night if you have one of those problems. But obviously, if you need care, you need care. And if we are there to be able to deliver that for you, then wonderful. And And one more thing about the PA issue, I think that we fought it hard, and the government basically said that, you know, we're not going to touch it, and we're going to allow them to be registered with the GMC, and have very little regulation about what it is that they are officially able to do. And I think that I think it's just wrong and just bad policy.
Nice one. Thank you so much, Andrew. Loads of really useful stuff there. We're going to rattle through maybe like 2 more questions and then we're going to go on to action. So please, people, bear with us because the action is probably the most important bit. So John Bosco, I'm going to come to you. There's a few questions. One around, are you encouraged by the launch last week in Parliament of the NHS working group chaired by Richard Bergen? There's also a couple of questions here, if you would like to comment on them, that kind of sort of relate to like influence of private companies at a local level, e.g. through GP services such as like Operos, and also this new IHO status of hospitals, which I personally don't know loads about, and that's maybe something we can research as well. But yeah, the kind of the launch of the working group and the influence of private providers at a local level, a few thoughts would be great.
Yes, so I was at the launch of the NHS working group last Tuesday, was it? I've forgotten. The days just mushed together. And it's really, really encouraging to see MPs beginning to take the initiative in Parliament to find out what's happening with the NHS and also work with campaigners on putting pressure on the government to push back. And I think it's really, really important that we have that kind of inside-outside approach of using parliamentary mechanisms because they have all sorts of obscure mechanisms that you could use to put pressure on the government, whereas campaigners, of course, like us, can stand outside and scream at them from outside. And both of them work together very well. And the letter that we worked with Simon Offer on, I think, is a very good example of this. We're able to put pressure on the government inside directly by kind of suggesting to them, and clearly there is a lot of backing for this among Labour MPs as well, that there is going to be a rebellion on this, but while also outside threatening them with public opposition. So that's really encouraging to see. In terms of corporate ownership of GP or local health services, some of you might remember that some years ago, an American corporation, Centene, that had a UK arm called Operas, bought, I think there were 50 or so GP surgeries. And what's really interesting about GP surgeries is that almost nobody does them for money. Of course, it's not, you might not go broke from doing them, but they're not very profitable. So what we've then found since then, I think this transaction happened in 2022, and Centene has actually ended up selling off those GP surgeries because they found they were not profitable. So I'm not particularly, I mean, obviously there's a lot of worry there because what Andrew was just speaking about, where they try to save money on your treatment by hiring physician associates to replace qualified doctors. And that poses a real threat to our health and well-being, while they just skim money off the top of their budgets. But I think that at the moment, it appears that the tide of that has shifted a little bit because there's not too much profit there. Where the danger exists is with, and I'm going to finish with this so I don't take too much time, is, for example, in eye care, in hip operations, in knee replacements, those sharp, quick operations that doesn't require a whole lot of work, that they could charge an arm and a leg for, sometimes literally. They don't have to do any post-operative care. They don't have to do any comprehensive care for afterwards. That's where they're making all their most of the money at the moment. And that is where we are really putting pressure on the government to invest in building the capacity within the NHS to do those things. And Andrew pointed out, I thought really powerfully, the fact that if you're outsourcing hip operations or knee replacements, or some of those quote unquote easy things, they're not easy by any chance. But if you're outsourcing them, these are the things that the NHS uses to train new doctors, right? And in essence, you are losing the opportunity to train the doctors of the future by outsourcing those surgeries to the private sector. And the private sector does not train doctors. So you're sowing the seeds of the NHS's I don't want to say destruction because I really, really don't want to begin to use that kind of language with the NHS. But you're sowing the seeds to undermine the NHS, and we absolutely have to keep fighting because otherwise, what's going to happen, right? If we don't fight, they'll just have their way, and we'll be like America. Nobody wants to be like America. Not even Americans want to be like America. Ask Andrew. He's right here.
USA, USA. Please, for fuck's sake, do not simulate anything having to do with our healthcare system. We're going to keep it far, far, far away.
Yes, well said,
Absolutely
Andrew.
right. Absolutely right. No,
Well
you
said,
can say
Andrew.
anything you want about my healthcare system there. Yeah.
Brilliant. And thank you so much, John Bosco. And apologies again, people, for going over. I just really wanted to have a chance for your questions to be heard. Sorry that we didn't get to every single one of them. There's just a few, like segueing into the action section that we're going to finish with. There's a few kind of very important comments and questions in here around what can we actually do about it, around kind of what policy solutions we need. I think certainly we're a big proponent at Just Treatment of progressive taxation. We think that there is a lot of wealth out there. It's just concentrated in the hands of a very few people and very few corporations who are not paying their fair share. We think that there is a way to fund these transformative policies by asking those people to pay more and not by hitting working people and kind of ordinary everyday people with like higher taxes. We think that is absolutely possible. It's a political choice. It's a political decision that the government is failing to make that we need to pressure them to make. And I think on the point about reform also, I think we don't have time to go into reform in loads of depth, but just to say that I think clearly something they are doing quite successfully at the moment is tapping into a very real sentiment out there of anti-establishment feeling, like a feeling that the system is rigged, that everything is broken, that nothing works, and that they're using that anger to very scarily and very effectively scapegoat marginalized communities. But we know who the real villains are. We know, we've spoken about so many of them tonight. Palantir, big pharma companies, private healthcare companies, like all of these companies and the politicians that are protecting them are the reason why so many of us can't get the care we need, why health workers are having a terrible time, and it's time to redistribute wealth and redistribute the power. And I think that our movement can have a big impact on wider politics, not just in health, if we stick to those principles and kind of expose and highlight who the real villains are. So we're coming to the end of the call, but as many of you know, we never end a Just Treatment call without sharing ways that everyone can take action. So yeah, as we've heard tonight, there are a lot of well-resourced profit-making companies who are making a killing out of the NHS crisis and who are relying on people like us keeping quiet and not kicking up a fuss. But we know that if enough of us take action together, our movement, both Just Treatment, but also the amazing organizations we work alongside, has the power to force change. We've taken on giant drug companies before and won. We've pushed the government to scrap previous plans for a GP data grab. And just earlier this year, we forced the most major government climb down yet over cruel disability cuts. So now is not the time to stay quiet. It's the time to get very, very loud. So here are some vital actions you can take right away. I think Chelsea is sharing the links in the chat. Don't worry if you can't get them now. We'll be sending them out via email. But just to explain them briefly before we finish, help us pressure Wes Streeting. So for over a year, NHS patients adversely impacted by the crisis in our NHS have been asking Wes Streeting to meet with them to hear their stories and ideas for change. Streeting has refused, yet as we've heard from Julia, he continues to accept large sums of money from donors linked to private healthcare. We think he should be listening to patients, not NHS profiteers, and we've come up with a range of actions that you can take to help pile the pressure on him. So that's number one. Number two, contact your MP about drug price hikes. As we've heard tonight, the UK government is set to cave to demands from Donald Trump and the pharmaceutical industry for the NHS to pay significantly higher prices for vital medicines. An announcement is expected any day now, so it's urgent that we raise the alarm on this reckless move. We've created a briefing for MPs about what's going on and why it's so damaging. You can help us spread the word by writing to your MP today. Number three, this is a really important one. Share your own story of the NHS crisis. As you've heard tonight, at the heart of Just Treatment's theory of change is a recognition that human stories about the crisis in our NHS are one of the most powerful campaign tools we have. They are able to cut through in a way that policy, statistics, and jargon simply can't. So if you have a powerful story to share about how the NHS crisis has affected you or a loved one, we want to hear from you. You can get in touch via our quick and easy story form. And then We Own It have a very important action, writing to your MP to urge them to oppose new PFI. We've already shared a link in the chat for that, but I think we're sharing it again as part of our big bumper edition of all the actions you can take. And also every doctor have got a fantastic charter for the NHS. It's aimed at growing a movement of thousands of patients and health workers united to remind politicians of the founding principles of the NHS. So as I said, yeah, don't worry if you can't access all the links right now. Maybe Chelsea, if you could just share them one more time in the chat so that they don't get lost. We will be sharing an email tomorrow with a recording of this meeting and also the links to the actions. So, sorry for going over, guys. It's my bad. It brings us to the end of our webinar. A huge thank you to our amazing lineup of speakers for their powerful contributions, and to all of you for joining us online this evening. We know it can be very disheartening to think about the way our NHS and our collective right to health are being attacked right now, but the best antidote to that despair is being part of a movement where we can take action together to fight for a better future for our NHS. The profiteering companies and the politicians who protect them are hoping we will just sit back and let all this damage happen, but we know we won't let them get away with it. So please take as many of the actions as you can, share it with your family and friends, and stay tuned for future actions you can take as well. And I'm going to enable everyone to unmute so everyone can say goodbye. Give me 1 second. Okay, you should, everyone, be able to unmute and say goodbye.
Bye.
Bye-bye.
Yes, I'm here, guys. Bye, everyone.
See you.
Great to meet you. Thank you for coming.
Bye.
Have a good evening. Keep taking the actions.
Bye.
Solidarity. Bye, everyone.